One, it would finally get rid of pre-existing conditions, which really hurts
Part
people.
of the old cherry picking, right?
Correct. The other thing, it would cover people up to the age of 27, so the children, and that's the largest number of uninsured people in this country are the people between the age of 18 and 24. And, you think, well, they're healthy, nothing's going to happen to them. Well, they get type 1 diabetes, they have accidents, they get pregnant, whatever. So, covering them up to 27, that's a significant help. That gets them covered. The public health insurance option, whether it be Medicare, I'd like to see it be Medicare, and if it's lowered down to 55, that's or I'd like to see it lowered down to zero.
That public option in itself seems to be the big stumbling block here.
Correct.
And the only thing that makes any sense. I mean, any other health care bill they pass, if it doesn't have the public option in it, forget it. It's the same old game.
Right. Well. People right now, probably, especially in rural areas, especially such as in Chautauqua County, the competition, even with the private health insurance industries, there aren't that many insurance companies. You may have only one or two plans that you can choose for. We might have like 3 major companies, let's say, but it's very common across the United States where, and there's this antitrust thing, so they, anyways, there's where that's removed, that will provide more competition and hopefully lower costs. Right now, if you don't have competition, you can keep your premiums higher, so that's being eliminated. That's a good thing. The out-of-pocket, there's an out-of-pocket spending cap for $5,000 for an individual, $10,000 for a family, and that's very important. That will help prevent many of the bankruptcies. And if, let's say, you have health insurance, but if your out-of-pocket costs are high, you become uninsured, and you frequently act like the uninsured. They do expand Medicaid. Some people don't like that, but we do need to provide health care, especially for the poor. They get sick, again, and we'll crash into the emergency room, and it will cost more. And then they'll fall right back onto Medicaid. So covering the donut hole, too. We hear about the donut hole. I don't agree exactly how it's being done, but again, the pharmaceutical industry is very powerful. They did ante up about $80 billion into this to get them to cover half of the donut.
Incidentally, I must point out to our viewing public, the guy in charge of the committee that wrote this bill suddenly retired and he's now running one of the pharmaceutical companies. This is the way it goes, guys.
Yeah,
the bill stinks. It's a lousy bill. Your Part D, Medicaid, Medicare, is just a hose job to the public in terms of your drugs. No generics, you can't compete. Oh boy, was that a screw job. And the guy who wrote that bill disappeared, and he's now running, I don't know which one, but one of the major.
It's Billy Townsend, and he's head of the U.S. Pharmaceutical Trade Organization now.
There you go.
But if you look at seniors, though, the survey, they like the Medicare. I think it could be better. But they actually like it, though it's very confusing. They don't like that part, but it has made prescription coverage more affordable.
Except for that donut hole you started mentioning.
Except for the donut hole, which never made sense to me. Why you get 50-60% coverage of your medications, and then all of a sudden it goes to zero for the next
2,000-3,000.
Yeah,
whatever it is,
and then it goes back to coverage.
Right.
Why it's there? So in this bill, the way it's currently written, that's going to be eliminated or significantly improved. There are also some measures in here to improve funding for health care. For health training of physicians. Right now, physicians are coming out huge debt. It's a couple $100,000 easily. That's the average coming out of medical school or dental school.
It only takes a week of practice to bring that up.
Yeah, right.
I'm kidding.
And that cost is getting passed on to the patients and to
Right.
the
It's gonna-
insurance
has this been passed in the
in the House.
In the House, it has. Now we're waiting for the Senate. And
Correct.
is this before the Senate, or did Senator Barkas just chop half of this all out immediately?
Yeah, I don't know exactly.
We know he
which,
chopped out the public option.
Again, that's what, I'm not privy to it. From what I understand, I get the same information.
Right.
But the thing I liked about it was that it's moving Medicare down to 55, though there at least, and that would help people out. That's who I see. Those are the people who I see that are the most likely to be sick, because that are uninsured, are people between the age of 55 and 64. So they've had diabetes or hypertension for years. They used to have health insurance, or maybe they didn't have health insurance. They now lose their job or whatever, lose their insurance, and then they crash in.
Yeah.
And that's probably the largest population.
Sure. Well, the corporations find that during that period of 50 to 65 or whatever, when you would get Medicare, you're very inefficient. So they fire people. When you hit 45 to 50,
Yeah.
you may expect to get fired for no reason, so they can bring in a 28-year-old who's much more efficient than you are. In the meantime, you now have no insurance.
Right, and then let's say you're lucky enough to survive to 65. You now enter Medicare sicker than if you would, and then you end up costing more. So this goes on over and over and over again. Medicare's, it's not perfect. High patient satisfaction under Medicare. Before there was any government insurance back in the 1950s, 1960s, 90% of the elderly lived in poverty in this country. Private health insurance industries were not providing insurance to the elderly. They were not getting treated.
Well, they didn't want them. They get too sick.
And then another thing that you're hearing out there is that they're going to cut Medicare. They're going to cut services. Or we hear about the Medicare. What's it called? The
Uncoupling?
Well, there's the Advantage plan. So, and about 17, maybe 20% of people on Medicare have this Advantage plan. Well, what was happening there is the private health insurance industry is taking over for Medicare for those people, and instead of going through Medicare, they're going through these Advantage plans. Well, the companies were getting paid around 15, 17% more than if the patients would have just stayed under Medicare. So here the government was overpaying to the private health insurance industry. So now they're trying to correct for that. So, and then people say, well, they're going to cut benefits. Well, they just passed I watched the debate on the Senate. They passed that benefits could not be cut. And they're not asking to cut benefits. They're just saying we're not going to pay private health insurance companies more than what we pay under somebody who's paying Medicare.
But I did want to mention, I mentioned that dirty word, uncoupling. That's one of the problems we're facing with Medicaid is the so-called uncoupling. In other words, I've got a friend who's a dentist down in Long Island. He tells me there's a big industry down there, and that is making little brass signs saying we do not accept Medicaid. All the doctors and dentists and everything. He says he takes a few Medicaid customers for dentistry, but he doesn't even bother billing because he gets like $10 or something for a huge job, and he says it's just laughable. And then he fills out all this billing stuff. The secretary spends an hour doing it, and then it's sent back because she forgot a comma or something. And so it just isn't paying off. And the hospitals are not getting anywhere near what their costs are normally under Medicaid.
I agree.
So a lot of people will not take Medicaid in the physicians. And then what's somebody on Medicaid do?
Well, then they crash into the emergency room.
Yeah.
So, I think that's why Medicaid, I'd like to see Medicare expanded and Medicaid be eliminated. I would like to see Medicare expanded to the entire population. They are two different animals. And the private health insurance industry, if people in this country want to leave the private health insurance industry in there, then we're going to spend another $100, $200 billion a year more for health care. We're going to have a more complex